Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us.
Well, thank you for having me on the program.
Yes, sir. I just want to begin with some international news. The Sputnik V vaccine, which has been subject of skepticism basically since Russia started using it, it's now about 91.6 effective against symptomatic COVID-19 cases. This has been published in some leading medical journals. Just your thoughts on that?
Well, I think we have been following the use of the Sputnik V vaccine. And we know that from the phase 1 and phase 2 trials that were published in the Lancet, that they were getting very good results. And now with the phase 3 trial, we see it's now settled at 91.6% efficacy. I think that's a really good number, and that puts it right on top with all the vaccines that are in the 90s. So it seems to be a very good vaccine, very safe, and it's being rolled out in a number of countries. I know as of August last year, the Russians had granted emergency use authorization in Russia, and there are many countries now in this region, in South America and Central America, that have also granted emergency use authorization of the vaccine. So I think it's going to make a difference in how in curbing COVID-19 around the world.
All right. I don't foresee this being a part of COVAX. You can correct me. But yesterday when we spoke, you said that the government was seeking other avenues. Is there a possibility that this may likely be one of them?
Well, I know for a fact that Sputnik V has been listed with the WHO for emergency use listing, and hopefully they'll be able to get that emergency use listing now that they have done the phase 3 trial and the data is in. COVAX, as of 2 weeks ago, in a meeting that we had with them, had said that they're looking at all options, including the Sinopharm vaccines and vaccines from Russia. So I guess once again, once they know that they're good efficacy with these vaccines, that they would be working with the manufacturers and the companies, negotiating with them to bring some of these vaccines into the portfolio.
All right. As we're with international news, we just got word that Moderna is looking at a third booster shot. I'm not sure if you can tell us anything more.
Well, a number of the vaccine manufacturers are looking at other options, and the primary reason for that is that they don't know how long immunity would last. So when you do the first dose, the reason you're doing a second dose is to provide a booster. And now they're also thinking that if the immunity would wane early, then you probably might have to do a third dose. So a lot of this is just a theoretical discussion, because we don't know how long, for the mRNA vaccines, how long the immunity would last. And therefore, they want to look at options, whether a third dose is necessary and then how long that would last. So that is an ongoing discussion among the scientists, and I guess we'll see published scientific literature on the matter.
All right. I wanted to ask you specifically about COVID-19 vaccine. So I have a list of questions on that. Can COVID-19 cause severe medical complications and possibly lead to death?
The disease itself, yes, can cause severe complications because, as you know, persons who get infected, about 80% or so, would have an asymptomatic version of the disease, meaning they'll have no signs or symptoms, or might have a very mild form of the disease. So they might have a cough, a dry cough, they might lose their sense of smell or taste, they might have some aches, they might have some headaches, body pain, things like that. So it's very mild. But that, for a subset of people, can then develop into having difficulties breathing. And if that occurs, that person would not be able to stay home and, kind of weather the problems that they're having. So once you start having difficulty breathing, most persons would come to the hospital, and at that point in time, you'll need hospitalization. So we have seen about 20% of the persons with COVID would end up in the hospital. And of that 20%, about 4% or so would go to the ICU, meaning that they would end up with a more severe form of the disease. Now, apart from the immediate or the acute problems that that person would have in the ICU, having problems breathing and so forth, you have some people, the COVID affects almost all organs in your body. So you will have some people that can have a heart problem. You'll have some people that can have kidney problem. You will have persons who would have neurological problem, meaning that the COVID would affect their nervous system. You have persons whose digestive system can be attacked by COVID. So multiple body systems are affected by the COVID virus. And when people recover, some people might have prolonged symptoms after they have been discharged from the hospital. And that is often referred to as long COVID because they continue to display various signs and symptoms. There have been cases that have been reported that persons who had the mild form of COVID, that after an interlude of a couple months, that some of these persons would come back to the hospital and they'll then have manifestations of other types of illnesses, so like heart problems or kidney problems or things of that nature. So yes, this disease can result in a severe form and would have fatality, as we know. And what complicates it is that if you're older, meaning that you're 65 and above, then you'll have a more severe form of the disease. If you have comorbidities, meaning that you have an underlying condition, such as diabetes, cancer, high blood pressure, heart disease, kidney disease, lung disease, these things can complicate, the severity of the disease that you will experience with COVID. So it is something that persons who might have comorbidities, meaning underlying disease conditions, that these persons should take extra precaution by wearing their mask and their social distancing and so forth, and persons who are older.
Just bear with me, this is the vaccine education segment. If a person, can a COVID-19 vaccine make someone sick with COVID-19?
The short answer is no, and that's because vaccines, how they're made or how they're designed, they would have maybe a small component of the virus so as to elicit an immune response. But that small component of the virus cannot infect the person to make them sick with COVID. And most of the vaccines that have been designed, they're designed in that manner. So if you get a vaccine, you're not going to get COVID. But you are going to be, your body would react to the vaccine to produce antibodies which can protect you if the real disease comes along.
All right. If a person already had COVID-19 and recovered, do they still need to get the vaccine?
Yes, because if you were infected with COVID, again, there are still studies that are ongoing to decide how long the immunity would last if you have had the infection. And some of the data that has been put out by the Center of Disease Control in the United States would say that once you get the disease, at least for another 90 days or so, you probably would be protected. But beyond that, they don't know. So it would be safe for persons, although they might have been infected, that they receive the vaccine or they accept the vaccine when the vaccine is made available, because this would add to the protection that they've already generated by natural immunity.
All right, I'll ask you one last question because today we're joined by some members of the private media, so we want to give them enough time. Can pregnant women take the COVID-19 vaccine or nursing mothers?
Again, there's no contraindication for pregnant women to take the vaccine or women who are breastfeeding their babies. But again, it's a personal choice if they want to do that. And with many of the clinical trials that have been done, they haven't had a large population of pregnant women or women who are nursing their babies in these studies. So definitively, we don't have that data. But the types of vaccines that are being used, the platforms that are being used, it is not anticipated that if pregnant women receive the vaccine or women who are nursing their babies receive the vaccine, that there would be any adverse effect.
Minister Anthony, thank you. Today we're joined by two members of the private media, Ms. Suan Wickham, she's from the Kaitour News, and Ms. Abina Rockcliffe, she's from the Guyana Standard. So, you guys.
Okay, great. Good morning again, Minister. At the presidential briefing last weekend, he really spoke on the sustainability of businesses during the pandemic, and he justified the reopening of bars. So some persons would like to know if the Ministry of Health would consider the reopening of cinemas, since studies have shown that persons are less likely to contract the virus there.
Again, indoor environments in a pandemic such as this one is a very risky place to be. And if you are going to be in indoor environments that are crowded, then it can pose a public health hazard. So with cinemas, we have had specific conversations with the cinema owners. We had teams that went in to assess the cinemas and the indoor space that they have. And that team that went in made recommendations to the cinema owners for them to install HEPA filters, which means that if somebody comes to the cinema and they have been infected and they're asymptomatic and they cough, that these HEPA filters would be able to clear out the viral particles. Since those recommendations were made, I'm not aware that any of the cinemas have installed such filters, and therefore we'll have to get another engagement with them to see whether or not they would be installing these. In addition to that, if you're going to reopen cinemas, then the preference would be not to have people eat or drink, because eating and drinking would require that you take off your mask. And again, as we know, transmission would occur once people's nose and mouths are exposed and we are in close proximity or in an enclosed space, then the likelihood of transmission can occur in such spaces.
Understood. As in terms of the test samples that were sent to CARPO, how often will batches be sent? And since Guyana lacks the capacity to test for that, is the ministry considering incorporating the testing, the genetic sequencing, into our health system?
Genetic sequencing is a very complicated procedure, and right now we don't have that capacity. Maybe in the future we'll try to build that capacity, but it's really a complicated process. Not just the equipment, but you have to get specialists in this area to be able to run the tests, do the analyses, and so forth. We would like to build that capacity, but it would take some time. We wouldn't be able to do that immediately. But as of now, we have been able to work out a relationship with CARFA, and through that relationship, we'll be sending at least 10 samples every month to CARFA so that they will help us with the genetic sequencing. We are also exploring a possibility through PAHO to send samples up to the US for the Center of Disease Control to assist us to do sequencing in the United States. So right now we are working out those details through PAHO to be able to send additional samples to the United States.
One last question. Some persons would have raised concerns about the opening of businesses, for example, bars and indoor dining and whatnot, saying that it might be giving persons more leg room to disobey those measures. So what is your take on that?
Again, as you know, we have to get a balance between the public health measures that we are imposing to keep people safe and also to ensure that people can earn. And so that has been a very delicate balance to have, because we can easily lock down the country and everybody stay home, but then we'll have a lot of people who would not be able to get monies, can't feed themselves, and so forth. So it's that kind of balance that we have to work out. And in fact, there was a survey that was done by one of the Caribbean authorities that looks at the economic impact of COVID in the Caribbean, and in particularly one component of that dealt with Guyana. And in that survey, they talk about the levels of unemployment since COVID has started, the amount of money that people have in their pocket, and what they can afford and what they can buy, and how that has changed, from the start of COVID in the region. So say around April, they did a baseline survey, and then they did back one, I think around September, and they do the comparison. And you can see how conditions have worsened for people because they didn't have money, they didn't have jobs, a lot of people were laid off. And these are the kinds of hidden impact that would have affected persons in Guyana. So we need to have a balance, and that's why we have been working to open workspaces safely. And in terms of restaurants, we've had, initially we allow for people to go there and pick up. And now we have limited the capacity for these restaurants. Now, we didn't just go and say the restaurants are all open and you can come in and do business. We have the Guyana Tourism Authority that has been going around to every restaurant, making sure that they're compliant with our measures, assessing the capacity that they have, then make a determination of what that 40% would look like. And they would put these flyers on the premises of the restaurant to indicate what is the seating capacity in these restaurants. In the restaurant itself, some of the measures that are supposed to be there for indoor dining, and which is being certified by the GTA. One is that at the table, the spacing, so you have to be enough space between tables, how many persons can sit at a particular table. So all those details are worked out, and then when you get the approval to open, there would be random checks by persons from the task force to ensure that you're complying with the measures that were put in place. If you don't, then the task force can withdraw that license to operate, and therefore we are hoping that by owners understanding this, that they would be complying. But we have a monitoring mechanism in place to ensure that we check on those who have been licensed to open.
Before question, I would like to follow up on something that you said earlier, which is that even the persons who have mild symptoms would sometimes go back to the hospital a few months later with other complications. Is this specific to a particular age range, or this is generally across the board?
Well, what we have seen, the persons who have the milder form of COVID are usually younger people, right? And so in a lot of cases, young people, you know, they get infected, they might have these mild symptoms, and then it's like a flu. So after a couple of days, they feel well, and if they don't come and get tested, we don't even know that they had COVID, right? If they come and get tested, then we'll know they're positive. We'll ensure that they go into the self-isolation for the 10 days, and we monitor them. But there are cases where after maybe 3 months, some of those persons might return to the hospital, but their signs and symptoms are not typical of COVID. In cases you might have signs and symptoms that are more in keeping with a heart attack, for example. And when you do all the assessments, they'll have problems with their heart. In fact, it is a myocardial infarction or rhythm disturbances. But the origin of this is really because of the infection that they had earlier. And therefore, you know, people really got to take this thing seriously, because you might get a mild form of the disease, but you don't know what can be the outcome, the long-term effects, and how that might affect you, right? And in fact, it's still a new area. So we have seen a few cases here, but this has also been reported in the global literature, and they have seen more cases in the US and other countries that have had a larger caseload than we have.
If I can turn my attention to understanding the rate of infected persons. One data has a figure of 10 persons infected. Is that just the 10 persons, or is it a variation of, let's say Abina was infected twice? Would she be counted twice or just as that one person?
No, I'm trying to understand the question, but
so if among the figure of 10 people, 3 of those people got well and then tested again and proved positive.
No. If for example somebody had multiple tests, it's going to record as one person. So for example, if somebody had they got exposed to the virus, they developed symptoms, they came to one of our testing institutions, we tested them, they're positive. If after 10 days and they remain asymptomatic, the WHO guidance has been that we discharge them without doing a second test. Some people or some persons, maybe to assure themselves, might want to do a second PCR test. If they do that test, it's not recorded as an additional person being tested, right? Because we would have gone through that process. It's recorded as for our purposes of how many tests we have done, we record that as a test, but we don't record this as a new case, okay. Right?
And regarding the situation with Brazil and their new strain, things does not seem to be getting better over there. We know that there is a certain culture at our border. I've been there, it's just a walk over the road. I know that there has been a lockdown as well, but are there firm measures being taken there to ensure that the traversing is at a bare minimum or non-existent?
We have a challenge with our borders because, as you know, they are open. And while we have heightened our presence on our borders through the joint services, if people really want to slip through, I think there are possibilities of that happening. But it's not only us who have heightened our presence on our border. On the Brazilian side, the federal police have also increased a presence on their side. And this has been happening for more than a month now. And that's because we have been in talks with them. And we are very pleased that they have also increased the patrols and so forth that they have on their side. So it's much tighter than it was before, and we allow for an official exchange of goods and services on Thursdays. So every Thursday there's an interlude where if there are goods from Brazil that is coming over to Latam, that's allowed, of course, given the protocols and everything else, and things from our side that goes across to Brazil. So that is done in a very organized manner, right? And so we continue to work on trying to be as vigilant as we can to ensure that we don't have the persons who might be infected coming across. In addition to that, you know that we have stopped the flights that were coming out of Brazil. And so all flights have been suspended, and it would remain so as we evaluate what is happening in those areas.
Thank you for that. So generally, we know from globally, COVID is not a disease that usually discriminates, but specific to Guyana, has there been found that a certain sector of society seems more susceptible or are being infected at a larger rate? And would this lend to reasoning that some sections are being taken less precaution than others?
I mean, COVID would affect everybody, right? As you rightly pointed out. So it doesn't have any discrimination in terms of a preponderance to one race or another, right?
Not the race, like oppressed communities,
in a sense, and we have seen some of that data out of the United States, right, where poorer communities might be more affected, but that's probably because they are not adhering to measures or not using masks and so forth. In Guyana, here again, I think most people understand the importance of wearing a mask. Whether they're wearing the mask, that's another issue. And whether some of them would have the mask and whether they're wearing it properly, that's another issue. Because sometimes you see people with masks on their face, but it's under it's under their nose, or they pull it under their chin, right? That's not going to help you, because what you're trying to do by using the mask is really to prevent viral particles from reaching your nose, because it then gets into the respiratory system, or viral particles to reach to your mouth, right? So if you have it below your mouth and your nose, obviously you're not protecting yourself from getting these viral particles. So we have to continue talking to people, trying to get that message across. And I understand, when you talk to some folks, they tell you that, we can't breathe, they make all kinds of excuses. But the bottom line is, if you don't do it, especially when you're in the public, you're putting yourself at risk of getting the infection, because we just don't know who is carrying the infection. So we have to keep regurgitating that message, even if it's sung very, like we're repeating ourselves. We probably have to find more innovative ways of saying the same thing, but the message basically remains the same. You got to wear that mask, right? Because it's important that you do.
Okay, my final question, personal one. Has there been any measurement of where Guyana has come in accepting the importance of taking certain measures and in understanding the seriousness of this illness? I know in the beginning a lot of people were saying it's not for us, we have a lot of sun, has the ministry been able to know if you've been making inroads in having the public understand what we're being faced with?
Yes. Yes, we have been able to do 2 studies through UNICEF to get an understanding of public's perception of COVID-19. And based on these surveys that were done, we are using that to direct some of our communication messages, right? So you would have seen in the newspaper, we are running a series called Mythbusters, where commonly held beliefs, right? We are trying to explain to people. So we put whatever is the thing that is circulating that people believe, and then we try to give the factual answer to it. So yes, and that's why we're doing it, because through these surveys we were able to detect some of these myths that people have, and hopefully by publishing information about it, maybe we can help to dispel the myths.
Well, that's it for today's COVID-19 update. We, of course, just spoke with the Honourable Minister of Health, Dr. Frank Anthony. We were also joined by reporters from the Ghana Standard and Kaieteur newspaper. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.